Hey, good morning. I'm Nesrine Awad Shimoon. I'm a psychologist. I work at the Robinese Center, which is a part of the Ottawa Hospital Brain Injury Rehab Service. And we offer transitional services for individuals with moderate to severe brain injury. Essentially, it's helping individuals with community reintegration. And as part of what we do, we work closely with community organizations in supporting our clients with their goals. And we have a residential service of 5 beds, as well as quite a significant outreach service as well. So what we're hoping to present today, Denis and I, is more on, in the realm of a partnership, specific partnership for transitioning or helping clients transition from hospital to home. So you can imagine how difficult it is going home after being in hospital for many months. It's hard for anyone, and it's especially more difficult after a brain injury, because the part that helps you navigate that and adjust and apply the strategies, the organ that helps you do that, the brain, is not working very well. And so it's a particularly difficult transition for individuals with brain injury to apply the strategies, to notice and learn what's changed for them. Oftentimes we hear about how they realize how fatigued they are, and piggybacking on the previous talk about how, there's a lot of information that's thrown at the clients in rehab. There's so many strategies, so many people offering information, but in terms of actually applying them to day-to-day life, that's a whole other ballgame. And it is difficult to apply the strategies. So similar to what was pointed in the PTSD talk just earlier, people have the information, but then what do you do with it? How do you actually apply it? And because of that difficulty, there are a group of individuals in particular who may not have a lot of physical difficulties after a brain injury and may not have access to a lot of the funded community supports. And so they are at particular risk of falling through the cracks. And this program was born for that purpose, to address safety and well-being concerns immediately after they're discharged. Okay, that was my very long intro. So we're gonna talk briefly about safe transition, and then the impact of having a partnership model in terms of ensuring a more rapid transition home, and then talk a little bit about the outcomes to date. Okay, so essentially, it's a partnership model with Vista. And what happens is we connect with the patients while they're still at the Ottawa Hospital Rehab Center. And we work together in establishing an individualized plan to address their concerns, needs, and to integrate the rehab recommendations. And I'm just going to give you a sense of some examples of goals that we might focus on. And this we would work together with one of our staff from Robinese, as well as one of the staff from Vista. And we determine who's going to be doing what, to what intensity, how long, that sort of thing. So it's all established with the clients. And some safety goals that we could address can relate to, managing their new medications, remembering to take them, knowing how to take them safely, managing sometimes this newly diagnosed diabetes. A big one is fall injury, so they may have some physical changes, and although they're deemed safe or okay to do stairs, for example, there still might be a risk because some days are better than others in terms of balance and things like that. For some of our clients, it might be supporting them with harm reduction strategies in terms of accessing and using substances like alcohol or other drugs. And then supporting them with their health follow-ups. As you can imagine, there may be a lot of medical appointments after they're discharged from hospital, and just remembering and attending those appointments, following through on the recommendations, we can also be targeting those things. In terms of well-being goals, so we may talk about managing or supporting them with mental health difficulties, accessing services, any suicidality that might come up. So those are things that would put them at risk from a safety perspective, as well as a strong focus on supporting the family, because as we all know, it's not just the client, it's the whole system that we want to empower and support. So, and the big one is paperwork. I think every human living in this country probably has a big burden of, following through, completing paperwork, submitting them on time, and that's probably the biggest thing that people procrastinate. And after brain injury, it's even more significant. So we can help with establishing a bit of a plan to address that. So in terms of preliminary findings, wow, I just discovered there's a screen right here. Okay. So clients have shown that they've been benefiting from prompting for medications and health follow-ups. They've generally been very open and receptive to information and education. They've expressed appreciation. Almost all of our clients have expressed that they've been quite satisfied with the services. Caregivers have reported having a better understanding of the strategies and feel better equipped to address concerns. So additional considerations, patients may be discharged sooner because of additional supports available, and that we hear all the time. So sometimes it's a bit tight in the publicly funded hospital system where there may not be enough beds and there are wait lists. And so the rehab team is reassured knowing that there's going to be support post-discharge, and so they may discharge their clients sooner. It is possible that with safety netting that there will be less return to hospital and emergency visits, and hopefully we can also have some impact in terms of the substance use or run-ins with the justice system and other safety concerns. So that's where I end, and where Denis takes over. Thank you.
So what we are also looking at are key elements identified of a good partnership, especially for a transitional program. So these are some of the factors that we've actually identified. Commitment by senior managers, which means the board, the executive director, senior managers, et cetera, et cetera. Adaptability and flexibility, because when we are doing a program like this, you have to change and adapt quickly to the landscape that changes. Collaboration is a very important one, that you are certainly wanting to collaborate and to partner, et cetera, et cetera. Standardize the flow, process, and documentation. An MOU, which is a memorandum of understanding or contract of what you do, what I do, et cetera, which defines the roles and responsibilities. And the last one is regularly and timely communication between all teams and transition points, as well as an evaluation. Data collection. Well, data is needed. We know that if you don't evaluate and you don't know what you're doing, you can't really improve your program. So we wanted some data for why, for administrative purposes, especially for the hospital, for public health programming, as well as in regards to the prevention and risk reduction in regard to, for example, tertiary prevention to safeguard against readmissions. Conclusions and next step. So the ABI transition program offers a framework of a partnership and some of the good elements of a partnership that can be applied in different settings. The key communications prior to discharge from hospital and following discharge are essential in ensuring effective and timely care. Next one is, as the program has progressed, VISTA and REC have trained and hired specialists that are experienced neurotrauma care nurse that links the clients, but also we have now a specialized transition team. And the last one, it is recommended, and I cannot say this immensely and highly and vocally and loudly, it is recommended that the Ontario ministries commit to scaling up this transition program to ensure the continuity of care and tertiary prevention that would save lives, as well as save the health system from the high cost of clients re-entering the health system with newly developed comorbidities. And as a thank you, we say thank you to all the healthcare providers and managers at the Ottawa Hospital Rehab Center, as well as Vista Center. And the last thing that I would like to say is this project is supported in part by funding from the Ontario Brain Institute in regards to their GEEK program, which is Growing Expertise in Evaluation and Knowledge Translation Program. Thank you again very much for your time, and I know that we're running a little bit late, but if you have any questions or comments or more information, please, you can grab a hold of us, and we will be certainly a pleasure to answer your questions. Thank you again for your time.